Falls, or the fear of falling, can significantly impact people's ability to have active and meaningful lives and have repercussions for the person, their family and friends, and on the NHS and social care systems. Falls are also costly to the NHS, estimated to be £2.3 billion per year. Falls are not inevitable as we age, and many falls and fractures can be prevented. The aim of health and social care services and their partners is to work together to enable the population of Wigan to enjoy health, independence, well-being and quality of life.
As a result of the number of falls and admissions, we've collaborated and written the Wigan Strategy for Prevention and Management of Falls and Bone Health, which is for all adults because reduced balance, falls and fractures do not only happen to older people, but can happen to people of any age. The vision for the strategy is that a person who has fallen or who's at risk of falls and fractures has timely, coordinated and effective evidence-based assessment and interventions to ensure that they are able to have a healthy, meaningful and independent life. This approach has been developed with a range of stakeholders across the NHS, social care, primary care services, North West Ambulance Service and many wider community organisations.
We've great services in Wigan and we work closely to support the health and well-being of people by increasing their awareness of falls and fracture risk and offering support to improve their well-being. One main part of this is the development of the falls conversation, which aims to change the narrative about falls and be able to signpost people to the most appropriate service. Training for staff has been provided in various ways to increase the awareness of the falls conversation and to increase the number of specialist trained staff who can offer a falls prevention assessment and intervention.
As we age, our strength and balance reduces if we don't challenge it in the correct way. In this case, Colin could refer himself into Be Well Council Services for Falls Prevention group exercises. When he's referred himself, they will have the falls conversation with him, and if he has any medical or environmental issues, he will be transferred to the appropriate professionals. All other wellbeing services have been trained in how to undertake the falls conversation. So you may be asked to have this chat, maybe with community link workers, care coordinators at Pensioners Link, Age UK, or via our Healthy Routes. In this case, Mary's developed a fear of falling, which is very common. It can reduce your activity and even lead to more falls and social isolation. So in this case, Mary or her daughter could self-refer via a single point of access team, where she'd have a conversation, she'd have the falls conversation with the nurses, and then she'd be transferred to the most appropriate services. Alternatively, she could speak to any health or social care professionals who could signpost her into the correct services. Via the emergency department, Graham would have been given a date to be followed up in our fracture clinic. There he would be referred or transferred over for a local fracture liaison assessment who would offer him a falls and bone health assessment. In this assessment, we're looking to rule out osteoporosis because we know 1 in 2 women and 1 in 5 men can have osteoporosis due to a broken bone. Thankfully, Teresa had an alarm in place to call for help. We worry about people being on the floor for extended time without calling for help because this can have a serious effect on your health. Whilst in hospital recovering from surgery, Teresa will have a falls prevention assessment and an osteoporosis treatment as indicated. She will then be referred for ongoing therapy on discharge to further improve her mobility and reassess her falls risk.